This is the Bartholomewtown podcast.
We made it work. Here we are.
Hey, two alternative media folks talking to one another. What an amazing thing.
It is. I mean, I guess, what's been interesting about this experience here is we've seen in Rhode Island, there's been a strong history of alternative media, certainly growing up here. And obviously, the Providence Phoenix comes to mind on radio. I think of WRIU, to a certain extent, WBRU. For me, as a kid growing up in the late 90s, and that paired with Channel 10 and the Providence Journal. Today, though, we see this almost wave of alternative media asking hard-hitting questions, and I'm not necessarily I'll exclude myself from the conversation here so as to not be biased, but
you can be biased. It's okay.
All right.
You need to be upfront with your biases and admit to them.
Well, I'll say that I think that the alternative media is playing a critical role in this story right now. Not that Channel 12 and so forth are, terrible people or anything like that, but they're asking a different series of questions, I think, from my purview than what, the specifics that you get into. Even Mike Billow at Motif, we see Steve Alquist, I guess combined alternative and traditional media are forging what used to be, what you'd get out of a daily newspaper here in this state, but in a way.
Those days are long gone.
Yeah.
And, if you're interested, I'll tell you, I have a long history with alternative journalism.
Let's get into it. Let's talk about more.
I'd first like to say it's sort of like what's happened is that the other news media behaved as if they were members of the country club. And if you weren't members of that country club, you didn't really belong and you weren't admitted and you weren't given the proper tea times to ask questions. And the new format has opened the door to a more level playing field. I still think that some of the other more traditional media resents the idea that they have to share the platform with others.
Oh, for sure. Yep.
And they still feel as if they're privileged. And they often don't, they pat themselves on the back and are very self-congratulatory about all the great work that they're doing. But the real hard questions are coming from people like you and Steve. And it's good to be able to have those questions be asked in a format where the governor has to respond. The governor has not always been, shall I say, open to responding to people. If you talk to the folks at Eco Rhode Island, they'll tell you it's been very, very difficult to get responses from the governor and her team.
No question about it. And, again, not so much to say that, Channel 10 or Channel 12. Channel 12 comes to mind here. I mean, they seem to be, they obviously have the pool camera, which for the listeners means they're kind of the mechanical organizer of the press conferences right now. And it did seem like at the very beginning of these remote press conferences, they were trying to get as many of their reporters on as they could and sort of try to dominate the conversation. They seem to have backed off that now, but just yesterday, a radio host here in Rhode Island ripped the alternative media, the influencers. He said, he's tired of a guy with a podcast with 18 listeners getting questions to the governor on a regular basis. So there is that sense of, hey, feeling threatened, because if they didn't feel threatened, they probably wouldn't be bringing it up as much.
So how does it feel to be threatened?
It's interesting, right? Very interesting.
I come to this position with a long history of journalism. I've been in the biz for, I hate to admit it, 50 years.
Wow.
And I've done, an enormous amount of work, both in the more traditional mainstream news media. My work's been published by the New York Times and the Los Angeles Times and Boston Magazine, among others. I've also written for Rhode Island Monthly and the Providence Business News. I was a reporter with them for a couple of years. But I was also managing editor of the Valley Advocate in Amherst, Massachusetts, which was the alternative weekly. And I was managing editor in 1976 and 1977.
Wow.
Um,
And did you ever sense during that period in Amherst? I mean, that's a place that's ripe for alternative media, a college epicenter. You know, I kind of always dreamed of working for the Phoenix or the Village Voice, and now that the rug's been pulled out from under there, you know, but you were kind of right at the beginning in a way of alternative weeklies becoming something that sort of was accepted by the masses, if for lack of a better way of putting it, I guess.
well, it came at a time, and I have thought about it a lot. You know, I wrote for the Village Voice. I wrote for the Boston Phoenix. I wrote for the Real paper. I knew all the people there. So I have, what was happening was something that it was the baby boom generation. There was not enough room for all of us at any one time as we went through. And the traditional news media was not doing a good job of covering. And the alternative media was sort of what I would call, if there were the major leagues, we were the Negro leagues.
Got it.
And we had all this, you know, talent and energy and innovation. And we were covering things in a way that with a writing style that just wasn't being done by your traditional mainstream newspapers.
When did so you were in Amherst and obviously sort of, it seems like spread around the region, obviously around the country with Los Angeles Times contributions. When did you kind of realize that, all right, the alternative media needs to be my platform, that I'm not trying to gun for a job at Projo, Boston Globe, et cetera. Instead, I'm more, I just want to build my work through these alternative platforms. Was there a moment that you said, all right, I'm done, if you ever even were seeking that?
Well, I found that I could play in both worlds.
Mm-hmm.
So it wasn't as if the people who owned the alternative media were dreams to work for.
Yep.
They were as hard-bitten as the owners of, say, the Providence Journal are today.
Understood.
And they practiced their own engulf and devour strategy. So the Valley Advocate expanded to Springfield and Hartford and New Haven and Fairfield, Connecticut. And and Stephen Mindich, who owned the Boston Phoenix, is notorious for his policies and how he ran things. And the Real paper broke off from them. So you have to understand that just as in the Negro Leagues, the talent was with us. And so we were recruited. So there are all sorts of people who came out of that world who are pretty well known today. So people like Gail Collins, who's a columnist for the New York Times, came out of the Hartford Advocate, and a fellow named Dick Pullman. He came and he was with the Philadelphia Inquirer for years, and Trish Hall, who used to be the editor of the New York Times opinion page, was an editor at the New Haven Advocate, and the list goes on and on. And I was able, you know, I left the Valley Advocate in 1977 and went off to do a story about the impact of mercury poisoning on the Cree Indians in northwestern Quebec, and ended up selling it to the New York Times Magazine.
Wow.
So, you know, I think talent and the ability to ask good questions and understand what a good story is will always triumph, even in a consolidated debt equity news media world. Fascinating.
I've tried to do that as well. And sometimes I would get, whether it's people on the left in the progressive flank that have said, well, why are you, you know, because I'm a fill-in host on WPRO. And some people say, oh, that's the station, you know, that's this right wing. But the reality is that the more people you can reach, and the more people that the more different types of people you can reach with a message. To me, as long as you're not, I wouldn't go on InfoWars or something like that. You know what I mean? But the reality is that if I could write an editorial and get it an op-ed and get it published in the Projo. Why not? Who wouldn't, in a sense?
Well, I think that's a good attitude. I mean, I think that everybody is hungry for information. Right now, we have this homogenized world where are we going to get our information from? And the value of convergence, which I began 7 years ago, is I think I provide a different way of looking at the world, which is to say, the arbitrary silos that people would like to divide people in by their characteristics don't exist. And people want stories that make the connections that, for whatever reason, they happen in real life, but they don't happen in the news. And somehow a 500-word article or a 30-second blip or a story doesn't give you what's really happening. The other thing that through convergence is I really believe that it's important to tell stories. Stories are probably the most important possession we have in our lives, our own personal story and how we tell it. And if we don't share it, it will get lost. And we're at a point where everything in our lives is being disrupted in ways that nobody imagined. So the way we work, the way we consume products, the way we talk to one another, how we learn in a classroom, what the actual workforce consists of what is a job, of do you go to an office or not, what is an essential worker. All those things are up in the air, even to the larger questions of how do we define wealth and philanthropy,
Right. Absolutely.
And so those are always big questions, and you're not going to draw the cathedral all at once. You need to focus. You need to find that window and ask the questions and build the story out, and people will follow you. So I think it's great, the work that you're doing in asking questions about what's known as the health disparities or the economic disparities or the social disparities, but know that you're not the only one who's been asking those questions. And there's a lot of information out there, and there's data out there if anybody is willing to look for it.
You've been at the front line of that conversation for at least it seems like throughout your career, but as you mentioned with convergence, covering health policy ostensibly here. And from your perspective right now, have we built a system, I guess a house of cards, if you will, where the rug's been pulled out and now we're seeing the result of, with COVID-19? Is it all that surprising that the disparities that are inherent in the system are resulting in disparities in the numbers and the impact of whether it's in the elderly population, particularly congregate care settings, or the Latinx community, whatever it may be? These shouldn't be shocking numbers based on the system that we've built, from my perspective. It just sort of reveals the challenge we've gotten ourselves into.
So way back when Dr. Michael Fine first became the director of the Rhode Island Department of Health, and I was working for the Providence Business News, I called him up and asked him how he saw the landscape or the future landscape of the healthcare delivery system. And he said, "Richard, we do not have a system. We have a market, and a market that's good at one thing, extracting wealth." And I'd like to believe otherwise, but we have a marketplace, and we have organized our healthcare resources around a business model. So, which is sort of just in time, just as stores only stock their shelves according to just in time business models. The same thing is true with a lot of our hospitals and our health system. So they didn't stockpile ventilators or masks or any of those things because they always assumed they could purchase those just in time. And the pandemic didn't fit into their business models because it didn't make business sense to plan for that. And so the pandemic has exposed all the what people call, the health inequities in our system, but they've been there. I quoted, Christina Paxson, who's president of Brown University, gave a talk in 2016, I guess that's 4 years ago, about unpacking health disparities. and it was one of her, key areas of study, or looking at the differences between white populations and African American populations. And what she said was quite astounding. So it's not like the information hasn't been out there. The question is, what do you do about it? And the state has embarked on a couple of different innovative projects. So I don't know whether you've done any work on health equity zones or know what they are.
I do, yeah. Truly, in recent times, I've been on some calls with the HESs of Providence, Newport, and just kind of sitting there and listening to what they have to say about the work they're doing. And that's in many ways, those Zoom meetings that I've been on the last month or so have really helped me to understand even more the need for testing, walk-up testing in certain zip codes and so on and so forth. But, I'm interested to hear your perspective on that on a much deeper level for sure.
So the Department of Health, under the leadership of Anna Novais, created a system of health equity zones, which was the idea that if you wanted to address the disparities, that 90% of the outcomes for health issues were going to happen in the community. They weren't going to happen in the doctor's office. And therefore, you needed to develop community-based solutions to deal with them. And so she got some money and some grant money, and over the past 4 or 5 years, I think their work began in 2014 officially. They've put together, I think, I lose count because some of the HESs have merged, a platform for health equity zones across Rhode Island. And last fall, you may remember that Blue Cross Blue Shield and the Brown School Public Health came out with their, I think it's called the Rhode Island Life Index. I actually have a copy of it here. It was on my desk. And the data constructs that they used were based on the data that had been developed by the community needs assessment done by the HESs. And that was also the same data constructs were accepted by both Lifespan and by the Hospital Association of Rhode Island in terms of here is how we're going to define how we look at community needs and assess what's needed. So they have, at least at this point, really stepped up to developing a source of data. The other thing that's interesting is the way that they have begun to knit resources together. So the work of One Neighborhood Builders as the backbone agency, and for, I guess it's the Central Providence Health Equity Zone, has been really intriguing. Have you had an opportunity to talk with Jennifer Hawkins at all?
No, I haven't.
All right. Well, here's a suggestion. You should get her and do a podcast with her, because she's
absolutely
at the center of a lot of stuff that's going on. And the other person who'd be interesting, if you can talk to him, and if you read my article about the work being done by the Providence Community Health Centers.
Sure. Yep.
Talk to Dr. Andrew Saul, who's the Chief Medical Officer. He's the one who's really on the front lines delivering care. And so to get his perspective and to have him be able to tell the story of what's going on, the work that we're doing is sort of, we're not telling our own stories as much as we're revealing people's stories to themselves and giving them a platform to share their stories. And for me at Convergence, it's not just health. I also cover innovation and research and education and community technology writ large.
And there's obviously a line in between all of those as well. The more the community infrastructure, the opportunity to innovate, it's fundamental to health outcomes, no question about it. At the end of the day, I mean, we need to find ways to pool our expertise, I suppose, to get out of the jams that we're in right now when it comes to health outcomes. There's no other way.
Well, it's not just health outcomes. I mean, I think we're at a really interesting turning point, which is we've tended to rely on experts. consulting groups to come in and dictate to us, usually with technology fixes. And it's based on a corporate model of top-down decision-making. And there's a whole other system of what I would call bottom-up innovation, based on how a community defines its needs and how it makes its decision and how it develops its solutions. And we're at a point now where the ability of the top-down to make good decisions and figure out what's going on, they don't know. And the current systems that we have and the business models, whether it be for hospitals or necessarily banks or the food industry, they're all going to have to change. What's going to drive it? Who's going to be the innovators? How do we listen to people in the community? Even, what we began with people in the news media. What do people want to listen to? What do they want to hear? So I think that the best feedback I get is that people really like and value what I produce every week.
There's nothing more satisfying than that it's not just, I guess, routine reading or something like that, checking in. I mean, where you really are consuming it and using it to inform your own opinions. That's ultimately the most important thing you can do, I suppose, as a creator of any sort, even an artist or whatever.
So it's not, and I don't see that as a function of my ego. Part of the biggest problem I think that everybody has to deal with as a writer, as someone who has to be in front of the news media like yourself on camera all the time, is to learn how to let go of your ego and to allow other people's stories to come through. And at the same time, you have to be upfront to knowing who you are and also like yourself enough to do it. And being able to have conversations. So I'm, once again, I'm still learning things. That's the best part about this job. Every time I do a story, I learn something new that I didn't really know before, and I have to dig in a little deeper and ask the questions. So this week, one of the innovations that's happening in healthcare is we're all going to telehealth. And one of the more interesting things that's come up is there are at least 3 and probably more texting software platforms that are being deployed by healthcare systems. And what that does is it changes the nature of the office visit. It's how do we talk? How does a patient talk to a doctor or a nurse? And can you talk back? And what is the daily dialogue? And a lot of that is occurring with COVID-19 patients on texting platforms. So the state has hit its own version, which is done by SurveyMonkey. And state employees have to participate. You're supposed to opt into the system, but if you're in a state employee, you don't have much choice about that. There's another system that's been developed by health-centric advisors, which is being deployed by Coastal Medical and other healthcare providers. Similarly, that is related to their own effort to try and develop mobile health platforms for people to be able to take their own blood pressure and have a daily interface with providers about that. So you have a remote mobile connection to providers. And that's a story that, I don't know anybody else but me who's covered it, but it has really profound implications as we move forward. So the next time you talk, I don't know whether you have a primary care provider or not. That's the other part of the story, is that although the whole thing about testing was built on the assumption that everybody had a primary care provider or could find one because it's written into the insurance regulations.
Right.
It is. I would say the estimates go from anywhere from 20% to 40%, depending on how alarmist you want to be, of people in Rhode Island who don't have a primary care provider, or even if they do, if they tried to get in and make an appointment, they wouldn't be seen for weeks. And if you wanted to obtain a new primary care provider or change a primary care provider, you're out looking at 6 months.
Yeah. No, it's a huge, definitely 100% a huge challenge. And then you wonder, okay, well, on the telemedicine side, all right, how close are we to Bluetooth stethoscopes, things like that, where,
Well, you're
elder care.
closer than you might think.
Yeah.
So that there are ways to stay connected. And there are good things about that and bad things about that, which means that you start asking questions about how we're using data.
Right.
Which is a whole other can of worms. But the question is who makes the decisions about how patients' voices get heard? The same thing is who makes the decisions about how the community's voice gets heard. So you've been really a stickler of trying to look at the data around zip codes. I think if you actually looked at a lot of the data that's already there, that's already been compiled, people know where the health disparities are. It's no secret.
Certainly.
And correlate that with the neighborhoods that are probably have the greatest likelihood of lead poisoning for children in Rhode Island. You can look at chronic school absences and correlate that with asthma and lead poisoning. And once again, whatever you want to call it, the health disparities. So the data is there. The question is, how do people respond to it? What do you do? So there's some news that's happening out of Central Falls about testing the population there. The question is, who's doing the testing? How are they doing it? What machines are they using? Who has access to it? Who's driving that? And some of the answers to that are surprising. I can't give you away the story that's there, but there are real conflicts of who's making the decisions. Is it the Commerce Rhode Island or the Rhode Island Department of Health of where the Abbott quick testing systems are going? Who makes that decision? And for the governor, who is she listening to as her consultants? Is it people at the health department? Is it people at Commerce Rhode Island? Are there a separate set of experts? What is the role of John Duffy in all this? I said it. He's an unofficial, informal advisor, but he is very much a key influential advisor to Governor Raimondo. And he's very involved with her communication strategy.
He, of course, of Duffy and Shanley, arguably the most influential ad agency here in the state. And he was a part of the Mike Bloomberg operation that came and went, the whole thing. So he's clearly inside that tent. And I've been wondering as well, I even asked the governor and she got pretty annoyed. I said, does the health department have the ability to override Secretary Pryor Commerce on decisions when it comes to reopening the economy? In other words, who's making the final call? And of course, she said what the predictable answer, which is that she will make a judgment call after reviewing the facts. But
so it's not but don't look at it as the Commerce Rhode Island versus the health department. Ask her about John Duffy and what his role is and how involved he is, and who are the other consultants. I hear that and in terms of who are the people, who are their team of experts that are looking at the models. I've heard word that Joshua Sharfstein, who comes out of Johns Hopkins, is involved. Also, the incoming dean of the School of Public Health, who's currently at Harvard. What's his role at this point? Is he a consultant? And then I look at who should be on the consulting team. So are the community health centers, and not just the head of the association, Jane Hayward, but are any of the individual people who are running the health centers involved in the decision making? Those are my questions, and I try not to, I get one question every 2 days, and I try and be polite and ask those questions because I have my sources and I can find out what's going on. Mm-hmm. So that's good. But, the other part of it is, we have to pay attention to the things that are also happening around us on the economic front. So there's a big event today on housing.
Yes, that's where I'm heading after this, the United Way event.
Yeah.
Yeah, exactly. That's 10 o'clock, right?
Yeah. So, but it's an interesting thing. Mike Ray of Nail is running that. Who's he working for?
Right.
Is that a contract with United Way? And who are all the housing groups? You know, there's a coalition of housing groups that was very involved in formulating a dialogue with the governor to get this done. I wrote about that in December. And they've been very proactive, and United Way. I mean, that was, I go back to the Rhode Island Life Index. That was their number one finding, that they needed to invest in housing. I think there are more fundamental questions about housing that need to be asked, such as we've built our housing based on the idea of the single family home, a suburban view of the world that may or may not exist anymore. It came out of World War II, and, you know, you can travel around all the suburbs, places like, you know, Barrington, and you can see all the houses were built by the same developers. They all look the same, except they've been flopped or turned around. They were financed by the GI Bill. They all cost maybe $10,000 originally. And it was the idea that families would move out of the city and move to the suburbs, and we'd build, you know, then came the malls and the highways. But all those assumptions may have to be, you know, reevaluated. You know, what do we need for an electrical grid? Can we create a different grid system that's more sustainable in the future? Tied into sort of renewable energy, but not just these big, huge plants, but rooftop solar, which is providing on peak days in New England 10% of the need for the power grid, according to the latest statistics. That's phenomenal.
Yeah.
And what does that mean if we have a community that owns its own power generation source? That provides for a community. So you look at what One Neighborhood Builders is doing. They're building four small homes that are all going to be off-grid. They're all going to have rooftop solar, and they're all going to provide for their own power, which is a really innovative solution. And once again, get Jennifer Hawkins on and talk to her, because the construction is proceeding. What will it mean in terms of nursing homes, which have been pushed far away? You know, that's the continuum of care. You get to a certain age, you know, you can't, it's too expensive to take care of you. So we put people in nursing homes because people are living older. What happens with nursing homes who are actually integrated into the community? These are questions that somehow we have to grapple with, and which we can't get in our 15 minutes of questions talking about with the governor.
No question about it. What's your take? What's your take right now as we move? I don't know. Phase one, whatever you want to call it. And we're seeing restaurants in Providence saying there's no way we're opening in phase one, et cetera, anyway. So it might not even look that different. But is the state ready to move to some kind of reopening? Are we ready to take that risk?
Well, I had an interesting piece on in Convergence this week. Tom Seguros wrote it for me.
Yeah.
And his question was, just because somebody tells you that they don't see the shark fin in the water, and you can go in the water, and he sort of said, well, you first.
Exactly.
Consumers tend to vote with their feet, and a lot of them, you know, are you going to risk your life by going to eat in a restaurant? That's a really good question. And how we have, I mean, I think we're going to move to a system of testing that becomes part of our everyday life. You know, people taking your temperature before you go into a building. People, they may test you in terms of, you know, being able to have, you know, we carry around our masks now with our keys and wallet and phone. We may have to carry around our card that says we've been tested and found negative for whatever that's worth. But I think the larger question, are you familiar with who Lori Garrett is?
No.
Okay. She's a national journalist. She's quite good. She predicted the pandemic and wrote about it 15 years ago. And she has a much larger framework to view this, what's going on. And she says, we're going to be doing this for 3 years, if not longer. And it really depends on when a vaccine is developed, and not only having a vaccine, but making sure that everybody gets vaccinated, which is in itself another issue. And how we move ahead on that is, will be problematic. And so it's human nature to want to go out and party and be social, but it really comes down to that question. Are you willing to go back into the water, and what's that basis of trust, and who are you going to trust? Are you going to trust, not to insert politics, someone like Mike Pence, who refuses to wear a mask at the Mayo Clinic? I mean,
yeah,
that's a total, empathic break, disconnect. And there was, it was pretty funny to see President Trump wearing eye goggles.
Yeah.
Himself, but not willing to wear a mask to protect other people. And whoever was the disc jockey playing Axl Rose overhead,
yeah.
Live or Let Die, that was really, really, really funny.
Yeah.
Who are we going to trust? And I think we don't know enough about the virus itself in terms of how it works. We're finding new, really awful things about what happens with some children. We see that it can locate itself in the kidneys and cause kidney disease. We don't know how the body responds, and how we're going to have to alter our lives. So, yeah, to try and set a day, well, we're going to do this. I think the governor, for her part, is doing a decent job of trying to make good decisions. I think the people who are upset about not wearing a mask, I mean,
come on, yeah.
Get over it. And the people who are demanding, give me liberty or give me death, I need to have my MTV, it's sort of ridiculous. And our lives are going to change. And, the other part of it is there are those people. I like to divide the world into those people who are parents and those people who are not. And it's a very different world if you're a parent and you have to care for a child in this type of environment, and how you want to be able to protect your child from those ills.
No question.
You're, if for whatever reason you don't have children, that really changes the dynamic. So I hope I haven't been rambling too much on all of
Great. No, this is super. This is awesome. I guess my last, area of interest, we could go on forever, but I know we've got both of us have something coming up in 15 minutes.
Yeah.
What's your take on the, the infrastructural changes that we might see when it comes to basic, and you kind of touched on this with the suburban changes, but grocery stores, pharmacies, getting a haircut, whatever it is, when the basic American day-to-day life, is there a way to marry that with where we're going to be for the next year to 3 years?
Well, our economy has been based on convenience.
Yep.
We can get things, we can satisfy our desires immediately. We can order things online and Shazam, they appear at our door. We can develop food cultures because we have become adept at taking food from the farm and getting it to the plate in expensive gourmet restaurants. We can indulge ourselves in a lot of extraneous things that may or may not be the most valuable things we have. So how we view cars, if we don't have to drive so much, if our workplace isn't located at a central office place, what does that mean for transportation? if we're not about to put our parents or our elderly folks who we know in a nursing home, because we don't see that as a petri dish, and they live at home, what does that mean for the nuclear family? It becomes the unclear family. And it's also true for, young people starting off in the professional world. Will they move back in with their parents, which has already happened a lot. When we think about the news media, we're used to getting our flow from a variety of different sources. So more people are checking out what you're doing, Bill. And, we have 3 different models for how the government talks. You have President Trump, you have Andrew Cuomo, you have Governor Raimondo. They each take a different tone of voice. And we're often caught, I was thinking about this, years ago when I lived in Western Massachusetts. I lived in a small side of the road town called Montague Center. The house that I lived in had been built as an employee housing house by the Montague Boot and Shoe Company in 1900, which went out of business in the Depression. The wooden frame was all built out of chestnut because the blight had decimated all the hardwood forests, and that was the cheapest wood. And the houses were very close together. So I had 2 old neighbors. One was named Mr. Morse and the other was Mr. Graves. And they sort of got along, but every morning about 9 o'clock, they would, Graves would be outside puttering on his lawn and Mr. Morse would walk by with his cane. And even though the street was very narrow, they would shout across the street at each other. Well, good morning, Graves.
Yeah.
You see the Red Sox last night? And so if you were listening, you got the Red Sox scores, you got the weather, you got the local gossip. But that was the way that they communicated. And it was, that sense of community and being knit together in a way that right now we have to plug in. The governor wants you to listen to her. Andrew Cuomo wants you to listen to her. The president wants you to listen to him, and he goes on for 2 hours. For what reason, I don't know. But I think we're going to have to rethink how we get our information and who we trust as a valuable source. And, so we're in a position where we get to ask questions, and hopefully we get answers. And, and hopefully the other people in the traditional news media will pay attention and at least give shout outs to us. Yeah. So they report not just on the questions they ask and the answers they get, but to everyone. But because everybody's tuning in, the feedback is, was that you asking questions, Richard?
Right.
Yeah. The answer is yes. And maybe that was too folksy a way to say it, but we really need to think about what our relationships with our neighbors are, our family is, the people who we don't know. Are we going to have to depend on the kindness of strangers to make sure that they're wearing their masks? What type of food we cook and eat, the convenience, where people doing takeout, and not to slam the Greater Providence Chamber of Commerce, but they had an ad for Fleming's Restaurant that they were promoting, where if you spent $250 on takeout for a meal, you get an extra $100 off on your next order.
Yeah.
And for the life of me, I don't know who spends $250 on a takeout meal.
Right. I can't, even if you're having a party, you know what I mean, which you shouldn't be doing right now. So it's.
But what I'm saying is it's the difference of wealth.
Yep.
And so a lot of people making the decisions, they have their jobs. They're not worried about their cars being repossessed. They're not worried about, being delinquent on their rents. They don't have to worry about where their food is going to come from the next day. The choices that they have to make in their lives are very different than other people. And that's the great disparity that we face. And how do we humanize that? It's not about empathy. It's really about understanding that people tend to think of themselves as being entitled. So is the CEO the one to tell us what should happen in the economy? Or is it the worker? Is it the hospital executive? Or is it the pediatrician who's opened up her own biz? And how do those voices get heard? Hopefully through you.
Likewise, I mean, I think that as we see new media sort of evolve, and social media is a part of it, but just where that conversation that used to happen, like you'd mentioned in Western Mass or whatever it is, just that on the ground word of mouth, that needs to be reevaluated as a primary source, I think.
Yeah, and it's hard to do today because how do you talk to someone? We don't have Chinese wall poster journalism where things get splashed on the wall.
Yep.
But we'll see. Anyway, thanks. It's a pleasure.
Supreme pleasure. I look forward to doing it again, hopefully. And I'm glad we did this. This was great.
All right. Talk to you soon.
All right. See you soon. Thanks.
Bye-bye.
This is the Bartholomewtown Podcast.